Hello and good morning to you. I'm Myra Ansari here for Wave Now. Hope you are having a good Monday after our weekend. I am not Dusty Baker, so let me take that out. Sorry about that. Just kind of getting into the swing of things for today. There we go. We are going live to UofL Health right now. They are giving us an update on their South Hospital located in Shepherdsville. Let's listen in.
People in this community. We're expanding our emergency department. It'll actually be an all-new emergency department. We'll go with inpatient services, which is something that does not exist in Bullitt County right now. So we'll have a full-service ICU as well as a mixed acuity med-surg unit as well.
You mentioned the big impact on the people who live here. This is a big deal for people in Bullitt County.
Yes.
Can you elaborate on that? Why this is such a need for a full-time hospital in the area?
Well, Bullitt County is probably one of the fastest growing counties in the state. The population has probably doubled in the last 10 years. And right now, for anyone that needs to be admitted to the hospital, their only option is to go into Jefferson County, which usually ends up either on the south end or in downtown Louisville. And a lot of the families that live out in this area, it makes it difficult for them to visit their loved ones, and they want to get care close to home. Everybody who's sick, they want to be close to home where they can be with their friends and family.
And what does that mean to those people? What could be the impact here?
Well, it could be the impact of saving their life, because when you get to, sorry, I touched your mic. When you get into heart attacks or strokes, time is critical. So being able to get that life-saving care right here and get stabilized within minutes, it makes a difference between traveling another 20 minutes downtown. It could be the difference between whether your heart has permanent damage or we get you right back to normal.
Construction started back in 2021, so it's been going on for quite some time. Can you just give an update on where things stand right now?
Yeah. So we are progressing rapidly. We have a wonderful team of construction working here, and they work long hours. Part of the emergency department is due to open late next month with our new waiting room and the new triage areas and the new fast track space. That'll be open first towards the end of August. And then they'll be progressing on through the upper floors. You'll be able to see some of that today. A lot of the rooms are framed up. They're putting in ductwork. They're running wires. They've already mocked up so we can see what an actual patient room is going to look like. They're working hard on the new pharmacy and lab. All of those spaces are rapidly progressing. The surgery area there's a lot of work that's been done back there. The cath lab is getting close to being ready for equipment to be installed. So it's exciting to see the changes every single day when you come into work.
And I know that the next part of this is hiring. There's going to be a lot of positions available. What are you guys looking for? That's event tomorrow. Not so much the details, but who do you want to come work with you guys?
Well, we have a hiring event. First day is tomorrow, and then Wednesday. We're really trying to focus this initial event on nurses because we all know there's a national nursing shortage. We really are kind of starting with looking at culture fit first, because we want to make sure that the people who want to come work here have the right attitude, have the right passion for providing care to the community and want to be involved in the community. We are all very active involved in community events, and we want our staff to feel the same way, that they really own it and know that these are their friends and neighbors who are coming to them for care.
Do you know how many openings there are? How many positions you guys are going to need to fill over the next year?
A couple of hundred. It's hard to say exact numbers because it'll depend. We progress increasing numbers based on census and how that goes. But with all of the different departments that we're adding, it'll be a couple of hundred employees new to the site. Oh gosh, we'll have expansions in our lab, pharmacy, security, registration. Food service. We've not had a cafeteria here, so that'll be all new service as well. Expanding the environmental services, our facilities staff, our engineering staff. So it's kind of every aspect of the hospital. A lot of those services are completely new for us. So.
And you mentioned too with the patients having a place in Bullitt County, but it could also be a pull for getting those nurses. Maybe there are some aspiring nurses or nurses looking to stay closer to Bullitt County. What would you say?
Yeah.
Get those folks living here here to start working here?
Actually, that's really a neat thing because we've had a lot of local people start to reach out that are very interested in just that and being able to work closer to home and being able to be part of what's exciting in their community. So we hope to see a lot of them over the next couple of days, and we're going to have additional hiring events going forward. Just trying to get a start and get a feel, but I do think the community interest for people who live close will be overwhelming. Some of them will be gradual. It'll depend on their experience. We have plans in place with our sister hospitals to start orienting those people ahead of time so that once we're ready to open and take patients here, we'll have everybody on site a couple of weeks before we open just to make sure we're all good in the space and we have everything set up. But ahead of time, we'll get them started at like one of our downtown facilities or maybe Mary and Elizabeth and do some of their training there.
And we talked to Heather about the opening date, but it's still January for I think like the full finished construction.
Construction should be done by the first of the year, but we're looking at March for opening because it takes time for getting everything cleaned and processed and licensure.
So fully operational by
March.
So you talked about how much
Yeah. It's exciting for me just to watch it progress on a daily basis, but to be part of actually opening a brand new hospital is not something you get to do, very often. Not everyone can say they get to do it in their career. So to me personally, it's very exciting and kind of fallen in love with a lot of the people in this community. So it's fun.
You guys good? Or it gets too loud, right?
Yeah. Nope, we just hope that we have a lot of people come out, and we're glad to talk to them about whatever their interests might be. And like I said, we're focusing our first event on nurses, but and cath lab techs, I think was the other thing. But we're happy to talk to anybody who has interest in learning more about our facility and what we have to offer.
And I'll send you guys the details of the hiring event. Tomorrow is, I believe, from 7 a.m. to 7 p.m.
No, it's from 7 to 2:30 tomorrow and 3 to 7:30 on Wednesday.
Perfect. And I'll send you guys the flyers. With all the info. All right, now let's put some hard hats on because Tina's only got about 30 more minutes with us. And Trent's got to go too.
Great.
So we're